First thing I've got to say is obviously I've only seen the reports myself today, so it's going to take some time to go through the 607 pages it is between the two reports. Initially, from what I've heard the Chairman of the Public Accounts Committee say, I think one of the important things to focus on is that on page 55 of their report in relation to staffing, they actually state themselves the department does seem to be turning a corner, and then go on to say, but there is a lot more to do. And in health and social care, we're never going to be short of things to do. There's always going to be more and more that's going to happen. I think also, we do need to focus on the fact there is a lot of positives as well, and there's a lot of work going underway. Some of the things you introduce in health and social care can take years before they get traction. It's not a case of, and again, the committee, to their credit, they do recognise that elsewhere in the report, that if you introduce something today, you sometimes won't see the results of that for a couple of years down the line. But there is a lot of work going on. And I notice as well that, of course, the recommendations across the two reports, what the recommendations do is ask more around the provision of data and putting data out into the public remit, rather than coming back with a raft of recommendations that says the department is heading in the wrong direction. It's not doing this, it's not doing that. We should be doing this instead. They've avoided that, and instead the two recommendations are purely asking for data to be published to Tynwald.
So what is the next step for your department? What will you do with this report?
Well, I think the first thing is we've got to read through it and digest it, because like I say, including the Hansards appended to it, it's 607 pages, so we need to go through in detail. But I hope when I read the full report that there will be acknowledgement in there of the work that has gone on, because there has been a lot. So just in the last 12 months alone, for instance, to give some examples, the job planning of consultants has been reviewed. There's moves towards the independent regulator, which I have, on the quick glance I've had of the report, been able to see they do comment on. The theatres review is now underway. There's work streams which we're progressing against the West Midlands Quality Review Service. The management team in the last 12 months has been streamlined by 33%, so by a third. There's work going on in accident and emergency and triage around waiting times. We've increased the number of consultants available in various specialities. There's more endoscopies now being delivered than at any time in the history of that service. We've got the private patients work underway that will give a clear distinction between what is private work and what is public NHS work. And we've also formed, because I noticed that the Chairman of the Public Accounts Committee there mentioned about community services and their importance to integrated care. Couldn't agree more, absolutely vital. And that is why one of the things that's happened in the last 12 months is we have formed the community division, which has merged 3 divisions into one. And so when it's mentioned about money being spare in the community division, actually that's mainly down to the hard work of the staff on the ground in those formerly 3 divisions that have now merged into one, and they've created great efficiencies. So in fact, rather than criticising the fact there's been an underspending community, I think we should be welcoming the fact that we're now providing more efficient services, and like I say, that's down to the hard work and dedication of those staff on the ground. And another important point is, of course, in terms of treatment, which when we were talking about a hospital is absolutely crucial, and waiting times. We've also made a pledge and already started working towards an 18-week referral to treatment pathway that wasn't there before.
Sorry. One of the points that they do make in the report, which I appreciate you haven't had much time to go over, is that there's been little improvement over the last year in terms of overspending. Would you agree with that?
I actually wouldn't, in that sense, in terms of Nobles Hospital. One of the things that we're very, and obviously I don't want to preempt my speech around the supplementary vote to the March sitting of Tynwald, but if you actually look at the breakdown, I mean, again, something the Public Accounts Committee chairman said that I do need to pick up on in the piece that you've just played to me, which is his interview. He mentioned about saying, well, there's been increases in budget over the years as well. Yes, there has, but even after the increases in budget this year, the department was starting with a £7 million improvement programme up at Nobles Hospital. So before we even started anything, there was that £7 million improvement programme to deliver. And the fact that the department is now coming in where we're saying we're going to, when we've seen potentially a pay award that is going to cost the department over 2 million more than was budgeted for, and we are seeing rising drugs costs, I think there is a lot of work. And again, I'd say it's down to the heart of the dedication of those staff on the ground, and I don't think we should be belittling the work that has gone on at that ground floor level, because the staff have been very much engaged in the projects that are going on, and I think they've been the ones who've been delivering it.
One of the other headline concerns, if you like, was over leadership and good governance. Ultimately, you are the leader of the department. What do you make of that?
I am, and over the last 12 months as Minister, obviously I've been involved with the governance. Department meetings are a lot more streamlined. There's a lot more, as I say, the management team has been basically realigned with a decrease by a third during my time as Minister. And I think that has led to a much more streamlined operation. But as I said, with any of these things, they take time to filter through. You don't change something on the Monday and see the delivery on the Tuesday. And I can understand why the committee might still have concerns, but I think the proof will be in the pudding over the next couple of years, and particularly with whatever the recommendations of Sir Jonathan's review are and the implementation of those. One thing I do agree with the Chairman of the Public Accounts Committee on, most definitely, is we do get one shot at this. It is a once-in-a-lifetime opportunity, this review with Sir Jonathan Michaels. And as Minister, I'm committed to be able to drive the service forward, and I think that report will help massively in that.
What do you make of terms like grave concerns? Is that a dangerous label to use when talking about the hospital?
I mean, it can be, but I mean, equally, I don't see those grave concerns coming out in the recommendations. The recommendations have been purely around publishing figures. I think if people have concerns, then, yeah, we need to look at those and alleviate those. As I say, I'm not going to go into detail on 607 pages of report when I've had it for, I think, about, 5 hours now, and I've been in meetings all morning, so I've only literally had a quick scan over it. But we will be publishing a full response, obviously. And what I don't want to do here as Minister is sit here and try and say it's all nonsense. We're just dismissing the concerns of the Public Accounts Committee. The Public Accounts Committee's done an awful lot of work in this. There's great value in having Tynwald scrutiny. I'm a great supporter of it. And I think what we need to do is we need to go through the reports in detail, see what the PAC has drawn out, and then respond appropriately. So I'm not going to get into a point-by-point response at this stage when I've only had the report for about 5 hours.
When can the public expect to hear a full response from the department?
Well, what will happen is, obviously, the report, which gets confusing sometimes for the public, the report is laid before Tynwald. So as the Chairman of the Public Accounts Committee said there, the debate isn't until May. So the stage it will go through now is the department will obviously consider the report. We'll come up with a response. That will then go through Council of Ministers as a Council of Ministers response to the recommendations and the report, and will be published. And I'm sure you'll be inviting me back in, which I'll be more than happy to do, to respond in full once I've actually had a chance to go through the 607 pages.